coming.
Good afternoon, Mrs. Baldwin.
Good afternoon.
So this is Nurse Thea, and we're just going to change shifts for today. And we are going to hand out important information about the nursing management and care of the client. Is that okay with you, ma'am?
Yes.
Would you mind to tell us the name and birth date of the client, please?
Roddy Baldwin, September 5, 1959.
Great, thank you. So let's begin. So our patient, Mr. Rudy Baldwin, presented with an episode of sudden onset of weakness and tingling in the left limb, slight confusion, and slurred speech. He was admitted today, April 5 at 9 a.m. in the Medical Intensive Care Unit, Bed 4. According to Mrs. Baldwin, he had bouts of productive cough 3 days ago, and he also had a medical history of asthma, diagnosed when he was 8 years old, hypertension, diagnosed 5 years ago, and also pre-diabetes, which was diagnosed 3 years ago. He has a history of smoking for 30 years, and he smokes about 10 to 15 sticks per day, but stopped smoking 3 years ago when he was diagnosed with pre-diabetes. Patient takes in medications such as diuretics, also antihypertensive together with statin drugs, but with poor compliance and non-compliance with metformin. He also takes in seretide Accuhaler and Ventolin as required. So the patient lives at home with his wife. Physical examinations reveal that the patient is indeed confused with left facial droop, slurred speech, left motor weakness of the upper limb with a score of 0/5 and 2/5 in the lower limb. Decreased tone, altered sensation, mild left-sided neglect, and slight carotid bruits on the right. Also, the patient is positive for Rales and Ronchi on the respiratory assessment. The patient's vital signs are within normal range, especially the BP and temperature. They are stabilized and the fever has gone down after giving the medications. Currently, he is on oxygen supplementation via nasal cannula at 2 liters per minute. And for IV fluids, he is on PNSS to run for 8 hours at 32 drops per minute. It was booked on 9:10 a.m. Laboratory tests are ordered and requested, and results are to follow. Refer the CT scan after results are available, and refer to neurology to Dr. Steve Arceliana for evaluation. For the medications, please refer to the chart. Take note that I've administered the first dose of the piperacillin tazobactam at 10 a.m. and the next dose will be at 6 p.m. The IV fluids is until 5 p.m. only. The patient is under CVG monitoring and also monitor for the vital signs every hour, and also take note of the INOs after every shift. So that would be all. Are there any questions or concerns before we move on?
No.
Is it clear?
Yes.
Okay, thank you. So do you have any questions, Mrs. Baldwin?
No.
Okay, thank you. So, thank you for your time. I will leave you to it and let the patient rest. We're gonna finish this handover. Please call us if you need anything, okay?